All right, we're going to get started. Good afternoon, and thank you for attending the Lunch and Learn series hosted by the North Carolina Center for Nonprofits, the North Carolina Office of Strategic Partnerships, and Voluntary NC. Today's program will be recorded and available on the Voluntary NC YouTube channel. The webinar link, as well as any materials provided by today's speaker, will be emailed to you by tomorrow afternoon, along with a survey and a link to register for our next program. As everyone enters the webinar, please ensure that your microphone is muted. Please enter your name and the name of the organization you're with as you enter the Zoom. And make sure to place your questions in the chat box and I'll read them out. But that will switch. We're doing things a little bit different today. And today's guest speaker, Dr. M. Chris Herring, will present today's topic, Emergency and Disaster Preparedness for Nonprofits. But before we begin, I would like to introduce our speaker. Dr. Herring has more than 35 years of service in the public safety, police, fire, EMS field. He has facilitated Federal Emergency Management Agency and U.S. Department of Justice courses throughout the nation. Dr. Herring earned a doctorate of ministry degree and earned master's degree in sociology, public administration, human services, and divinity. Dr. Herring is an associate professor at Sandhills Community College and an adjunct professor at North Carolina Central University, NCCU, where he is also a fellow for the Institute for Homeland Security. Dr. Herring, thank you so much for facilitating this important topic today.
Absolutely. Thank you for the invitation, Ms. Moore. Before I get going there, do you have people in the waiting room that look like you're bringing them on in? Absolutely great. Absolutely great. Let me get ready and share the screen here. All righty, what do we have up on the screen?
We do have the PowerPoint, Dr. Herring.
Absolutely great. And once again, Ms. Moore, thank you for all that you do and everyone in your office. We have a rich history working with your department going back more than a decade, actually. So you're just a great resource for the state of North Carolina, and we appreciate you. I'm actually coming to you after meeting Ms. Moore when we facilitated a course, a workshop at the historic Shaw University. So that networking is always great. Let's start off, and I'm going to ask you all for a moment to take yourself off of mute, and we'll try to not talk over each other, but I just want to hear a couple of responses. What are some emergencies or major disasters that have happened or can take place in your community? What are some of the major emergencies or disasters that have happened or can take place in your community? Can we just get a couple of shout outs and responses to that? We will have to, there you go.
We had major flooding in our community.
Major flooding, thank you, Ms. Coates. Somebody else, please.
Flooding in our smaller collection institutions, like smaller, volunteer museums and things.
Flooding again.
From either weather or pipes bursting.
Weather or pipes bursting. Good, thank you. Let's get a couple more.
We've had hurricanes and tornadoes in our area, so.
Hurricanes and tornadoes, thank you. Let's get a couple more. I know you all say you didn't know you're going to have to say anything today. Anyone else want to share? All right, so when we think about when we've heard flooding, when we've heard hurricanes, when we have heard tornadoes in our great state of North Carolina, we can also think about ice storms. We can unfortunately think about wildfires. And we also have to think about things like, unfortunately, airplanes do not always stay up in the sky. trains do not always stay on the track. There are a number of things that can happen in our great state, especially with the hurricanes and the tornadoes. And what makes today's session so important is for your nonprofit, for all that you do for your community, how is it or what is it that you're going to do if, one, you are impacted by a major disaster emergency? And we're also coming from today from another perspective. Potentially, what are some things that you can do to assist your community in being part of this system here? In order to help out with disasters and emergencies in your community, it's good to have an understanding a little bit about the system that you would join. How many of you have? Here's a good question if you want to respond there or not, but I'm going to ask the question and then I'm going to pause. For your nonprofit, for your organization, for the one that you work with or that you manage, how many of you know if you have an emergency operations plan in place? And what a written emergency operations plan, what we're speaking about is saying, okay, if something does happen at that or at your organization, what's the plan? How are you going to carry through? Because something could happen while people are there, while people are not there, but especially while people are there and depending on your organization, if visitors are there. It's always good to have an emergency operations plan. Does anyone so I will ask, let's see, how many of you have an emergency operations plan? Just raise your hand, use the symbol, or I see one hand up. I see two hands up. Good, good, good. Because if you do not have an emergency operations plan, that's something that you really want to follow up with your county or your city emergency management office and see about developing that. A lot of these slides, the majority of these slides are coming from an 8-hour course, certified course through FEMA. I mentioned that was the one that I met Ms. Moore at, mobilizing faith-based community organizations in preparing for disasters. And it's in collaboration with the Rural Domestic Preparedness Consortium. It's funded by FEMA, managed by the Center for Rural Development, and North Carolina Central University is a proud partner of RDPC. Here's a statement that we use in the course, and it was from a report after Katrina. And when I read the statement, I want you to sort of put on the hat of your organization or other organizations that could help out the state and the community in wake of disasters. FBCOs did not augment the government response. Rather, they took the lead and the government augmented their efforts. To move along quickly here, we can use another word. Faith-based community organizations. And how about this? We'll throw in for today's session, we're saying nonprofits did not support the government response. Rather, and nonprofit and volunteer organizations, rather they took the lead and the government supported their efforts. So it's just a paradigm shift in the way that you think about it. If something were to happen, rather than sitting back or standing and seeing what is it that I can do, wouldn't it be great that if you were part of the system and instead you're automatically put into action, and then your city or your county or other organizations are saying, what is it that we can do to help you help others in your community? It's just a paradigm difference in the way that we think. It's important to understand too that FEMA operates under Federal Emergency Management Agency operates under the whole community approach. This is an outstanding approach when you're thinking about disasters and maybe major emergencies. The concept is this: it takes everybody. It takes everybody to be engaged. And unfortunately, our state has been challenged by some of your responses. The flooding, the hurricanes, the tornadoes that have of course, many people have died, high cost to property. And when it comes to recovery, it's taken a long time for some communities and individuals to cover. But look at this whole community approach. It means it takes It will take families, businesses, faith-based, non-profit groups, schools, media. It will take all levels of government to assist during the time and after a disaster or a major emergency. And the key part of that, when we see that, when we think about it will take the whole community, and I'm so glad you're with us for this Lunch and Learn, because the best way to engage and to play a part and being part of that whole community is to get engaged before an event takes place. National Preparedness Goal, core capabilities. And the National Preparedness Goal, if I were to just sum this up very quickly, think about the diverse, and also with the next one, but just think about the complexity of our great nation. So FEMA says, how can we break this down to make sure that we cover all aspects that we need to that might relate to an emergency or a disaster? Another way that you can think about this is, what role might your organization play to assist? Prevention, protection, mitigation, response, and recovery. Though there are those things that activities that can take place prior to a disaster emergency. There are those things that can take place to help protect, mitigate. Mitigate means reduce the risk there, response and recovery. And as we go through this information over the next few minutes, you'll see other mechanisms and opportunities how you can get engaged from these different levels. NIMS, I love NIMS. NIMS sounds so boring to many in the field initially, but it has turned out to be just such an important issue. Here's how I'll begin by explaining NIMS, and think about our state. Think about Asheville and up in the mountains of Asheville and how different those communities are than, let's say, Wilmington and on the beach, let's say, as compared to Charlotte and that urban area, or Ahoskie and going that way. We're so fortunate to live in a very diverse state, and that's why many people love to visit here and why many people love to live here. But what NIMS does, it allows us to, it provides a language for first responders and people in the public sector and folks in the nonprofit to speak the same language, no matter what the incident or what the location is. So someone can come from the coast over by Wilmington to go help out within the mountains beyond Asheville. And what's great about it is they'll come after they've been NIMS certified and trained and speak the same language and being able to help each other out in the many diverse areas, such as public utilities, such as public health, such as fire, such as helping with animals. There, we know that's an important issue as well with pets. NIMS provides a consistent, flexible, and adjustable national framework, allows all entities, government and private, to work together to manage domestic incidents. And when you think about NIMS, I'm focusing on North Carolina because that's really our focus today. But NIMS is something that is national and is even becoming international. But as you become trained in NIMS, it also will assist your volunteer agency or your nonprofit to help people out in South Carolina, to help people out in California, to help people out just all over the country. Everyone will be trained with the same basic language, the same basic skills to be able to help each other out. You can easily search online and you will find this through FEMA, National Incident Management System. And then give you an idea, a little bit of the components of NIMS: resource management, command and coordination, communication, and information management. Once again, today is a lunch and learn. We only have a little bit less than an hour. So we're just trying to whet your appetite and give you a good taste so you can go forward and grow and seek and get more information. Here, what we want to do for a moment here is we're going to carry some of you back to high school and middle school. We're going to speak about government there. As you play a role or not only play a role in disaster emergency management, there, or as you strengthen the resiliency of your own organization, the ability to bounce back, it's sort of important to understand the different roles of government. I like to break them down to 4 roles. To give a little overview: federal, state, county, and local. Some people like to put county and local together, but let's begin with local. With your, we're speaking about, as you see in the next slide here, your city government, your towns, and things like that. And so what's the role of cities and towns and counties? Develop emergency operation plans, coordinate with state and federal agencies, deploy first responders. Here's something that's so important. You're hearing the business quite a bit there, that disasters and emergencies start local. Everything starts local. If this was a full session, 8-hour session, I would ask 4 people to line up, and I would ask one of them to pretend that they're federal, one state, one county, and local, just so we can visualize some and speak about that structure. When we're looking at local government and things starting local, we know that local government has to make sure that their rules and their policies do not come in conflict or supersede the county government. But what does it mean to be local here? I pretty much mentioned this. We can also consider school districts, special districts, and all of that. So as you are working with your nonprofit or your volunteer agency, when it comes to disaster management, you want to have an understanding or build a relationship with those at the local level, because that's where everything starts, right there at the local level. From the local level, then we think about the county level. And most counties, especially in the state of North Carolina, have county emergency managers. And it is those county emergency managers that sort of lay the foundation for emergency operation plans there. When taking an all hazards approach to emergency preparedness, citizens must be prepared for natural and man-made, human-made incidents. What all hazards mean is, if you're not familiar with that, that means we have to be prepared for everything. Not only the diverse number of emergencies and disasters that can take place that we spoke about at the beginning there, but then we have to be concerned with and be prepared for chemical spills, for ice storms, for fires, for floods. Just the all hazards approach means that we have to be prepared for anything and everything in reference to disasters and emergencies that can happen in your community. And once again, remember there that when it comes to emergency management, while the county and the state and federal government can step in, emergencies and disasters, that response begins locally. Role of state government. So we have local government, we have county government, we have 100 counties in our great state of North Carolina, and we have state government there. And we know when we're going from one level to the other level going up, one cannot supersede the other. The other way I like to think about it is this way. When the local governments, when the cities and the towns get to a point where they need help and they can't handle it alone, they have the counties, right? And when the counties get to the point that they can't handle it alone, they have the states. And when the state gets to the point that it can't handle it alone, it has the federal government there. And of course, the planning and the training, everybody should do that all along there to prepare. It is the state government that communicates with the federal government. And when it comes to disasters and emergencies, of course, FEMA is the primary organization there. The Federal Emergency Management Agency is the federal government's primary agency responsible for disaster management. FEMA is intended to support the state and local emergency response capacity, but is not. Now, here's the big piece that we really want, I was asked to put some emphasis on. FEMA is not intended to be the first on the scene in the wake of a disaster. And that's one thing that you can really communicate with your neighbors and your friends and the organizations, because sometimes people will get upset, well, where's FEMA? Where's FEMA? By all means, yes, FEMA can come in early and play a role at the request of the state government there. But for the most part, FEMA's not intended to be there initially, right? Not intended to play a role at first. When they're needed, when it looks like things are going to be beyond the scope of handling it for the local, for the county, for the state, then the federal government steps in. And by having that understanding, it might cut down on some frustration sometimes when people wonder where FEMA is. I should also mention this. This is not all inclusive. We're just showing, giving as an example. We could mention tribal. We have Cherokee here in North Carolina. So that's another form of not government, obviously not, but that's another form of entity there that we have to deal with. If we were in Louisiana or New Orleans, we would call them, in New York, we would call them boroughs there, of course, there. And in New Orleans or Louisiana, we would call them parishes there as well. But we just want to make sure that we understand that there are structures in government and organizations and communities. And and by the way, I'm speaking a lot right now because we'll stop in probably about 10 minutes, 15 minutes here and see if we have questions and answers where we can have some discussion. You may have heard this before, a federal disaster declaration, a federal disaster declaration. That's when we get to the point where a state says they can't handle it alone. And the governor of the state declares a disaster. Now let's go back here. Let me slow up for a second here to make sure we understand how this works. The declaration of a disaster allows services, not only at the federal level, but at the state level for these things you see here: personnel and supplies, disaster relief, technical advisory assistance, medicine, food, and even reimbursement of money there. But when a disaster is declared, it sort of takes like a formula of information that is needed, right? Well, what's the level of loss of life or injury? What's the level of property damage? All of those things and more are calculated at the local level, at the county level, and at the state level. An important point here to understand is when a state declares, makes the declaration here, it's not all counties in the state that are necessarily declared, right, for that declaration. And it's not all cities and towns there. And that sometimes can become an issue because someone might think, well, how come my county was declared, but yet the county next to me wasn't, or the county next to me was, and my county was not. And I think a good point here is to think about this. The governor's offices depend on local information in requesting a disaster declaration. So the more that people are informed at the local level of the information that is needed to assist to make sure that that disaster declaration can carry through, it increases the odds for that happening. But that, of course, means that at the local level, you have people who are trained, who are part of the system, and who have understand. When we deliver this on the road, it's not unusual for those in attendance to have had the experience of living in across the street from each other. One house is in one county. Right across the street, the neighbors in another county. Both homes have been damaged. And when the disaster declaration takes place, it took place in one county, but yet not the other county. The other thing we want to mention on here as well is just because there's a request for a disaster declaration does not mean automatically mean that it comes. Non-government organizations, and this is really refers to many of you today here, as support agencies, regardless of clear hierarchies. NGOs help where, when, and how they can. Coordination of services such as damage. The point here when you look at that is, wow, nonprofits and volunteer organizations, they are such a backbone and a foundation for our great state, and making sure that our resiliency is strong. And when we say resiliency is for an emergency or disaster, when something happens, how quick can our communities get back to normal, right? There are some very popular NGOs. One of the more well-known ones, and one of the few that's chartered through the federal government, is the American Red Cross. And at this point, we want to start thinking about if you want more information, if you want to get engaged with the disaster emergency management system in your community, one arm that you can reach out to is the American Red Cross. They help out with so many different things, including being aware of connections with sheltering and responses to fire. And I'm sure many of you have worked with the Red Cross in your community. If not, make sure you reach out and get engaged. FEMA has VALS for each state, voluntary agency liaisons. You can speak with Ms. Moore, you can speak with your county emergency management to learn who the VAL is. In a moment here, you'll learn about other organizations that are already there, and not only organizations or programs where you don't have to reinvent the wheel, but FEMA does have somebody assigned to our great state to help specifically with voluntary agencies when it comes to emergency management and disasters. Here's a great one, Community Emergency Response Team. Let me slow up here for a second. You can throw up through, you can give a verbal response, throw up the hand through Zoom, or actually your hand. How many of you have heard about CERT? Anybody, have you heard about CERT? I see one hand raised, I see two hands raised, I see three. Absolutely outstanding. The Community Emergency Response Team program provides interested citizens with training and basic disaster response skills. And for the most part, you will go through your county emergency manager to get CERT started, but it is great. It provides training that we may see here in a second on those things that are needed to make sure that citizens are engaged beforehand, during, and after for emergencies and disasters. Faith organizations can create a CERT. At North Carolina Central University, several years ago, we started a CERT. I mean, we even gave academic credit for it, and it's getting ready to get back up running. And Ms. Moore's office assisted us with that years ago. I've had somebody from the Red Cross come to me, and they wanted to start a senior citizens CERT where senior citizens can go to senior citizen facilities to help train and teach about CERT. There, I've seen youth CERT, getting the young people engaged there as well. So once again, here's something that's already established and packaged. That's a great resource and opportunity. And here you'll see some of the things that CERT trains in. For those that know me, this is the most that I've talked without engaging folks in a long time, but we'll get to the end here. Another great organization, once again, think about what we're speaking about right now. There are already so many programs that are established where you do not have to reinvent the wheel there. The Medical Reserve Corps, and you do not have to have a medical background to become part of the Medical Reserve Corps. Maybe your nonprofit or your volunteer organization will say, well, yeah, that's or faith organization says, that's something that we have the resources or an interest in. Let's check up on the Medical Reserve Corps to play a role to strengthen the resiliency of our communities. I was pleasantly surprised at the workshop at Shaw University to learn that North Carolina has such a strong state VOAD program there. Ms. Moore, once again, can assist you with getting in contact with them. Some of you may be part of it, but it's just as it says, and you can do an internet search on this for National Voluntary Organizations Active in Disaster, right? So many resources, so many diverse organizations and entities that are engaged with national VOAD there. So it's that umbrella organization for large nonprofits and also small nonprofits. And you can see some of the things that take place. And once again, North Carolina has just an outstanding VOAD initiative. State and local governments can possibly reimburse voluntary organizations for certain things. The thing we want to mention here is when it comes to getting reimbursed, you really want to be part of the system ahead of time. You really want to be plugged into the system ahead of time. So with your city or town government, with your county government, with the state government, through the Red Cross, through CERT there, especially if a declaration, disaster declaration is declared, but even separate from that, there are possibly opportunities for reimbursement, but it's best to really be engaged ahead of time. Let's try this here again too. I just want to hear from you for a moment here. What's the difference between having a plan and planning? Can somebody help me with that? What's the difference between having a plan and planning? Anybody? And you'd have to take yourself off of mute.
When you have a plan, you're already prepared. When you're planning, you're trying to implement something by teaching, training, education. You're in the process.
Thank you, Faye. Anyone else? Yeah, so you can have a plan, as Ms. Coates said there, written down, policies, papers in place, but you have to practice that plan. You have to exercise that plan. It just can't be on the shelf. So you create the plan, but planning is a living process that you're continuously going through. And when we talked about emergency operations plans, please, if you don't get much of anything else out of today, definitely make sure that you follow up with your agency to see if it has an emergency, a written emergency operations plan, and there's some planning that goes behind that. In other words, people coming to the table, running exercises and things like that. Planning stakeholders. If you want to have an idea of what this looks like from a city perspective or a county perspective or a state perspective, here are the planning stakeholders. And clearly understand that volunteer agencies and nonprofits are part of this. So you should be possibly, right, part of the city, county, or state planning process when it comes to preparing for emergencies and disasters. So now that as I look at my time there, and I know I have just a little bit of time, remember, hurricane season in North Carolina is real, right? We've learned that we've been damaged by fires, right? In Lumberton and also in Eastern North Carolina, and my roots are in Duplin, North Carolina. The flooding is real, right? So what are those things that we can do? And since we don't know what tomorrow will bring, to better prepare ourselves for these disasters and emergencies. And unfortunately, in this day and age, we have to think about things like active shooters and other things as well. All citizens must take responsibility for emergency preparedness. That's the only way their community will be resilient in the face of an event. As I slow up here for a second and we move towards the end to have conversation, you know, I'm so committed to this because this is so real, right? When you think about police, fire, emergency management, often for a community, they're only about 2% of that population when you think about visitors and citizens there and all that. There is absolutely no way that government can handle it by themselves. They can't respond. They can't take care of all needs immediately when in wake of a disaster or a major emergency. That's why it's so important for others to play a role there and for all citizens to be prepared individually, but also for nonprofit and volunteer agencies to understand how they can support as well. Community Lifelines is something that FEMA uses to just make sure that we understand that we have to be concerned with these community lifelines. These are the things that have to be kept up and running, or if they are damaged, this is where the priority has to go, right? These are the things that we rely on to have a certain level of day-to-day life activities. And how do we know that? Anytime that any of these are cut off or something happens, a community is challenged and suffers. Components of a basic local plan. We're not going to spend much time on it, but we want to let you know that your city emergency management, your county emergency management, your state emergency management, there are different emergency operation plans that they have. Ms. Moore and I, when we were speaking, we put this one in because we just want you to think about for your organization. It might give you an idea of some of the elements of your emergency operations plan, your EOP. Gives you an idea of some of the things that should be included in it. That concept of operations, preparedness, mitigation, response, and recovery. It's just that higher level understanding of managing and being prepared for emergencies and disasters. What is a risk assessment? I know we're throwing a whole lot at you. We just want to throw some pieces at you at this lunch and learn session where you can go back and follow up. What are the risks in your community and what are the risks to your organization? It's always good to do a risk assessment. That's another one. If you haven't done it, please, please, please do it. Personally, I believe you ought to do a risk assessment for your family, right? For not only your family, but obviously your volunteer organization, your place of worship there and all. What are the risks most likely that can occur, that possibly can occur, but you need to plan for there, a risk assessment. When we think about, so this is a picture of developing and maintaining emergency operations plans. We're putting in a lot of pieces here so you can leave this short session being able to go back and get some resources there. So here's another document from FEMA, developing and maintaining emergency operation plans. And normally when you see FBCO Annex, I'm speaking with city and county and state emergency managers and reminding them that they have to include volunteers, faith-based organizations, NGOs in their emergency operations plan. Maybe it's throughout it, or maybe it's an annex, that special piece that's at the end of their plan that discusses the role that they play. Here's another great resource here for places of worship, guide for developing high quality emergency operation plans for houses of worship. Even if you are not a house of worship, this is a plan that you can use to help you with your non-government organization or your volunteer organization there. You know, what happens if there is an active shooter there? What's the plan? What happens if there is a major fire? You know, what's the plan? What happens if there's a big accident out in front of the building there? What's the plan? What happens if a tornado hits during? So there's just, we don't mean to sound doom and gloom, and we're not doom and gloom as long as we know that there are certain things that we need to prepare for. Here's a paradigm shift, something different I want you to think about when we speak about emergency operation plans. And I see my time's about running out here so we can get some Q&A. But here's something I want you to think about. If you want to assist your community, right, before, after, or during disaster, you have to make sure that your own organization, your own families are taken care of. I hope that makes sense. Continuity of operations, it's just that. This is another important piece here. For your organization, what is your plan to make sure that operations can continue? The major functions can continue if your building or organization is hit or damaged, right? You want to make sure that files can be backed up. You want to make sure it's understood where you all will go to meet. Somebody mentioned flooding, you know, there. So if your building is flooded, now what? How do you relocate? How do you make sure that you can continue to operate, right? Continuity of operations, because many other people might depend on you, and you see some resources there. And as we finish this up, what we did was we put just a few resources on there. And I think Ms. Moore said that this is going to go out for you. Ready, North Carolina, where you can go there, and it has a lot of resources for families, right? As we enter hurricane season there, but other things as well, right? Your families and individuals just need to be prepared to take care of themselves for several days. Ruraltraining.org, there's a plethora of training for rural and small communities that you can request, often through county emergency management or other organizations. There's a lot of FEMA online training that I don't say free, it's no cost to you, but I said we've already paid for it. So when it comes to some of the things that I mentioned, you can go online and get training, some great programs online. And then Marcus does a great job in his shop over at the DHS Center for Faith-Based and Neighborhood Partnerships. If you are not engaged with that, I encourage that you do become engaged with that. They'll send out emails for webinars and information and a lot of different things there. In reference to FEMA, North Carolina is in Region 4. So I have talked a whole lot, and I will now be quiet a little bit. And Ms. Moore, we'll see if we have any questions or discussions that we want to address. Anyone have any questions or comments? My, this is the quietest bunch I've had in a while. Or is it that I did such a great job? Any questions or comments? Okay, Ms. Moore saying, while I can go on, I will say that that's all that I had.
All right, and I'm going once, going twice. Anybody else have any questions? Comments? You got a great job today, Dr. Heron. You got to thank you. Well, all right then. Dr. Heron, thank you for taking the time today to share your expertise with us. And participants, thank you for joining us today. Participants, you will receive the following: today's webinar link, a survey for today's program, materials from today's program, and registration links for our upcoming programs. The next Lunch and Learn webinar, Engaging Youth in Volunteering, is Tuesday, July 16th, 1 o'clock to 2 o'clock p.m. So please take a few moments to complete our survey, and your responses will allow us to continue providing webinars relevant to your organization. Thank you once more, everyone, and have a wonderful afternoon. If you have any questions, Dr. Heron and I will be here in the chat until 2 o'clock. So if you want to ask any questions, then please feel free to do so.
Thank you, Ms. Moore.